Okay, a 24-year-old woman is brought to the ED with her sister who said she was acting bizarre 2 days ago. She's been pacing around the house. The neighbors are trying to read her thoughts, plotting to kidnap her. She's also claiming to hear whispers. So as you do this, note the psychotic symptoms. It's very important. On exam, she's distressed, scans about the room, speaks in short paranoid phrases. Her urine toxicology is negative and her vitals and labs are normal. What's the diagnosis? Okay, this is actually tougher than you'd think. Here are the answers. Give yourself a second, try to break it down. All right, so let's explain kind of what's happening. She's acting strange, delusions. Why? Reading her mind. Hallucinations, voices, 2 days ago. Timeline super important for all psych stuff. No history of mental health. It's 2 days ago though, okay? And that means we can actually eliminate schizophreniform, which is a very common choice. We can just eliminate this guy, right? He's gone because that has to be greater than 1 month. And that's the most common reason. So schizophrenia, that has to be more than 6 months. Schizophreniform, 1 to 6 months. Delusional disorder, all right, that'd be if she only had delusions. Bipolar, you need to have a super energetic and a manic state, and she doesn't have that. Acute stress disorder, that would have to be, the onset would be like a trauma or accident. Brief psychotic disorder, let's leave that one on because that one seems like it might be the case. Schizotypal personality disorder, that's a lifelong disorder, and it's not sudden psychosis. Schizoaffective, the person must have mood issues too, like depression or mania. So that's why it's not schizoaffective, because they'd have to have like depression or mania. Okay, so that's going to be our answer. If somebody starts seeing, hearing things lasting less than a month, I can't emphasize enough, less than a month, brief psychotic disorder. So it's greater than 1 day, less than a month, full return to more normal function. Sometimes it's triggered by stress. That's a brief psychotic disorder. That's all we got for you. Peace out.